Assalamualaikum doctors. In this video I am discussing about a history that is infective endocarditis. So infective endocarditis, that is a bacterial endocarditis. Some important features I am telling, easy to remember. From gen, F for fever, R for rot spot, O for oslar nodes, M for murmur, J for genuine lesions, A for anemia, N for nail bed, there is hemorrhages, and E for emboli. Now the chief complaints like that come with 3 days later came with fever, malaise, tachycardia and weak pulse. So came with fever, malaise, tachycardia and weak pulse. First we will analyzing the chief complaints. What is the main concern? So fever, awareness of heartbeat, fainting, chest pain and inability to walk. Okay. So when did fever, awareness of heartbeat, fainting, chest pain and inability to walk? So when did they start? Which symptoms started first? Is it increasing or decreasing? What did you do for that? Associated with any symptoms like rigors, fits, night sweating and swollen glands. Then CVS we are asking like history of any fainting episodes, exercise intolerance, blue lips, awareness of heartbeat, blood pressure measured in human. General activity, appetite and sleep. Other concerns are dysmorphic features, long-term any medical condition or chronic illness. This is very important. Long-term any chronic condition, maybe known case of VSD or any heart condition. So known case of VSD. Since when, how he was diagnosed, who diagnosed him, any admission with its detail, if any, which team he is following with, any medications he is taking, any similar attack before requiring admission and antibiotics, COVID contact, COVID vaccine to close contacts. So VSD, it is a heart condition. Previously, we asked since when and how he was diagnosed, who diagnosed him, any admissions with its detail, if any, which team he is following with, any medications he is taking, and a similar attack before requiring admissions and antibiotics, COVID contact like COVID vaccine to close contacts. Then the systemic review from the chest, recent cough or cold, difficulty in breathing, noisy breathing, snoring during sleep and asthmatic recurrent chest bugs. CNS about headache, weakness, facial asymmetry, eye deviations, any concern about vision. So any concern about vision or eye is very important because we know eye some changes, there is eye rot spot. Then hearing or speech, unusual in walking pattern and change in mood. Urinary change in pee amount, color, frequency, pain in the loin, pain during pee. So pain color is very important. Then MSK skin spots, any painful or painless lesion on the hand or top of the finger, tip of the finger. So this is very important. We know there is nail bed or hemorrhages present. So any painful or painless lesions in the hand or tip of the finger, muscle weakness, difficulty in climbing stairs or any getting up, swelling hands or feet, bone or joint pain or joint swelling. GIT about the tummy distension, tummy pain, throwing up especially in the morning and change in poo. Hematology, pallor, bruises, bleeding and bugs, endocrine, cold intolerance, blood glucose test, perinatal, any event in pregnancy, jelly scan result, newborn screening and NIQ admissions. Puberty started, menses, is it regular, boyfriend, OCP and protections. Vaccination is up to date, any concern, recent vaccinations, allergy to food or medications, nutrition on a special diet, type of food, amount, growth chart. Development if below than 2 years. Family, describe your family for me, consanguinity, similar condition in the family, family history of cardiac disease, any history of sudden death in the family. So if a family history of cardiac disease, any history of sudden death in the family, social, school, psychological impact. As usual we ask. So this is from the features we know that it is infective endocarditis. We can keep some DD like viral myocarditis, COVID-19 and pneumonia. Again infective endocarditis, viral myocarditis, COVID-19 and pneumonia. So mainly infective endocarditis, we understand the features what we find. Fever, heart racing, previous known case of any heart cardiac conditions present. And then the child has fever, rot spot, oslar nodes, murmur, genuine lesions, anemia, pale the child, nail bed, there is hemorrhages present and emboli. So this is all about infective endocarditis history. Thank you.